Hello and welcome back to another episode of Visions for Health. I'm Wendie Trubow and my guest today is Dr. Sarah Byrne. She's a medical doctor and also board certified in family medicine and practices functional medicine. Welcome.
Thank you.
Thanks for being here.
Thanks for having
me. You were the first guest on our show.
I know.
I'm so happy to have you back.
I'm back.
So today we're going to talk about mold. And there's a number of different ways that mold can, I would say, irritate people. But it sounds like we're going to focus on environmental as opposed to foods, but that is also there, correct? Okay. So how would people know that they're sensitive to mold?
So mold is one of those things that sometimes can be a little bit sneaky because it's in the environment, but we don't always know it's there. Reasons we might look for it would be, let's say someone comes in and they're getting recurrent sinus infections or recurrent respiratory infections. And we start to think about, okay, what is taxing their immune system and why are they having these illnesses? One of those things to think about might be something in the environment. In functional medicine, you know, we like to think about all aspects of why someone is maybe not feeling optimal. So we think about, you know, their genetics and what they're eating and their stress in life and nutrition and things like that. But one thing to think about is also environment, and that's sometimes missed. And sometimes when people come in, I like to ask them, you know, when you started feeling that way, did you have a change in environment? Did you start a new job? Did you move to a new house? And then you start to explore along those lines.
Can a flood occur that causes mold?
Absolutely. So some of the molds that are the more problematic ones occur because of water damage. So let's say there's a leak in the bathroom and maybe it's not found, and then you start to see something on the ceiling, and you know, then it's dealt with. Sometimes before that you end up finding that, you know, a small leak can then promote mold in the environment. So there might be particular molds. So in water damage, certain molds that are present in those situations can produce almost like a toxic effect for some people.
And how would people know? What would symptoms occur that they would have?
Yeah. So some people have allergy to mold, and some people can actually get pretty sick from it. I don't know if you've heard of like sick building syndrome or, you know, people in certain environments that get ill. So let's say somebody has an allergy, then that might more look like when they go in their basement, they feel stuffy, or, you know, more allergic symptoms.
So coughing,
asthma,
rash?
asthma.
Is eczema part of that?
Could be, yep. Okay. So eczema, we think about environmental allergies and food allergies as being a component, so mold could certainly be in with that.
Okay.
And then some people might react in a different way, where let's say they're in an environment that has mold present, maybe they don't realize it or don't pay attention, and then the more that they're there, they start to feel maybe more fatigued or get chronic pain, or maybe they're diagnosed with fibromyalgia, or they have, you know, mental, you know, fogginess or neurological symptoms. It can sort of present in some strange ways. So this might be someone maybe who's seen their primary doctor, and then maybe they've seen some specialists, and you know, nobody's not really sure what's going on.
And are these people who generally feel fine and then stop feeling fine, or does it creep up on them?
It can kind of creep up, so I think the more exposure, but it might be someone who said, well, you know, I started to maybe not feel well, I'd started this new job, it's in the basement of this building, you know, and then the more time they spend there, they might notice not feeling well. Or maybe they go in and they feel worse at work. So another thing to think about is when maybe if you're not feeling well, do you feel a lot worse when you go into certain environments, whether it's, you know, work or home or down in a basement, or I had one college student who had started college, and a lot of his classes were in basement. You know, they're not the newest buildings sometimes, and he ended up getting really severe eczema and allergies.
So can you just drill down into, for people, the difference? So there's the allergic component, which you mentioned, which is the stuffy nose, the postnasal drip, the asthma, the cough, headaches?
Sure, headaches, yep,
fatigue,
sinus headaches, yep.
Sinus infections. You said respiratory infection, so like recurrent bronchitis.
Sure.
Does pneumonia qualify as that?
It could be, yep.
Okay, but upper respiratory things.
Yeah.
That's an allergy.
Yes.
And then there's non-allergic reaction.
Yeah, we think of it more as it's more as a toxicity effect.
Okay.
So these particular molds actually produce something that's called a mycotoxin. So it acts as a toxin, especially on the nervous system. So it can affect, that's why we think about foggy brain or neurological pain, things like that, that it can affect people in that way.
Okay.
So these people are going to be genetically predisposed to being more affected by mold than another person.
And then the people who have an allergy, you just mentioned that the people who are toxic with mold are more likely to have a genetic predisposition.
Yes.
Are the people who have an allergy to mold also more likely to be predisposed genetically?
That's a good question. They may or may not.
Okay. So
there
it's
might
really
be other reasons why their immune system isn't dealing well with that environmental exposure.
Okay. So the people who
food or-
get sick or sick building syndrome are
Yes.
people you could test their genetics.
Yes. Yep. So there is a genetic test that's available that looks at, is this person maybe predisposed to getting sicker than another person from mold? So let's say someone doesn't feel well, we're thinking maybe it could be environmental. We could do a blood test, which is a genetic test that looks at, does this person have a setup to maybe get sick from this exposure?
Okay. And is that useful for people up front, or is that usually something you do for people once they're sick?
Probably more.
You probably only see them once they're sick.
Probably more once they're sick. I mean, if you moved into a new house and you're dealing with a mold issue, maybe it would be a good thing to know whether you need to, I've had people who actually have to get out of their environment because it's making them sick.
Do you recommend testing? If someone's contemplating a move to a new home,
Yeah.
do you recommend that if they know they're sensitive that they test the new home before making an offer or moving?
Absolutely. Yep.
Okay.
So if someone's sensitive, I mean, this can be really detrimental to a person's health if they're sensitive in this way.
Yeah.
So let's say you know that you carry those genetics to be predisposed. Certainly, if you're moving, start a new job, buying a house, then maybe thinking about either testing it yourself, and there are ways to do that where you can actually you can test dust for mold, the presence of mold.
Yourself, or you send this away?
Yep, so you can test it and send it away. So let's say you complete that yourself, because getting inspectors, I mean, it does cost money. So, but let's say you find the presence of mold, then it's probably better to have someone come in and test, because it might be behind walls, or it might not. We're not necessarily talking about in the shower. There's something there,
Right.
but this is going to be more. It could be hidden.
And do you recommend people stay away from whole house humidifiers or humidifiers in general, or how do you balance that out?
You have to be really diligent. Yeah, so you have to be really diligent about those things. So if you have a super dry home, using a humidifier might help you in some ways, but you just have to be really good about cleaning it. So if you leave it there, you don't want to be brewing something that then is going to not help you in the end.
Right. The best of intentions.
Yeah, exactly.
And can we talk a little, is there cross-reactivity around people who have an allergy to people who have toxicity? So can someone who's eating, I know we're talking too much about food, but if someone's eating foods that are moldy,
Yep.
can that activate both the toxicity and the allergy?
It could, actually, yeah. So certain foods carry either mold or even can have mold toxins in them. Unfortunately, coffee is one. Sometimes I know it's very sad.
You're not the good news bear today.
I know. It's really, the more you get into it, it makes life harder. But so coffee can have mold in it. Certain
cantaloupe,
nuts, peanuts,
pistachios. I heard.
Yep. Some grains. So cereals.
Like our favorite grains, or
cereals and
all cereals?
I don't know.
Okay.
Yeah.
Certain cereals?
Probably certain, because of the grains. So some grains have mold.
How do we find out which grains have mold? Is this?
I think it'd be something you'd research, I guess, if
I'm
you
not
have
sure you want to know the
other
answer
problems.
to this.
But and then certain ones can cross-react with certain problems. Let's say someone has reactivity to aspergillus, then there's certain molds certain foods that can cross-react with that problem. So it gets a little bit complex.
This sounds like a consult.
Yeah, exactly.
Okay. So someone, though, what I'm trying to drill down into, someone who's eating just a regular diet, drinks their coffee every day, eats the melons when they're in season, peanut butter and jelly. These are people who can be making themselves sick inadvertently.
That's right.
Okay, and I know citric acid is moldy. I've spoken to one of our nutritionists and I said, why don't you like citric acid? And she said, because it's moldy.
Right. There's sort of a whole spectrum, you know, with yeast and mold, and we think about also digestive balance and the presence of sometimes yeast in the digestive system. That can trigger people, so it gets pretty complicated. So you're trying to, you know, think about digestive health and presence of those flora. Are there too many yeast there? You're trying to think about allergens, you know, respiratory allergens. Is that an issue? And then you think about more serious molds and the toxins that they produce, and that can be an issue. So
how common is this?
I think it's complicated. So people who are genetically predisposed to mold, I don't know, maybe 30% or something of the environment, of people in general. So it's not uncommon, but you also need the exposure.
Right.
So let's say someone has this, but they never are exposed, you know, they might never notice anything.
Do you find this in your practice a fair amount?
Sure. No, there's been some very interesting cases that have, you know, come out where when we pin down when symptoms happen or when they started, you know, ended up being an environmental issue. Some people have had to get out of that environment and feel dramatically better. You know, I've had people had to move or change their jobs, which is unfortunate, and kind of, you know, you try to do other things, but, you know, the main thing is if you're predisposed and you're in that environment, we can't treat you, you know, because you're still being exposed to it. Basically, those toxins, they send off sort of an inflammatory cascade. We all know that inflammation is a problem for everything. You know, inflammation can cause you fatigue, and it can cause weight gain, and it can cause, you know, all sorts of symptoms. Our body doesn't like inflammation. So mold is one of those hidden
like
causes
inciting events, or
it can be yeah, exactly. So it sends off this inflammatory cascade with our immune system, and that's sort of what ends up triggering symptoms for people.
So can you talk about that college student you saw?
Yeah, yeah.
What did he? You said you mentioned he came in with eczema.
Yeah, very severe. So this is you know, this is someone who you know, went to college, was, you know, healthy kid, and ended up having to leave school because, you know, he felt terrible, he was fatigued, he couldn't concentrate, you know, he was extremely itchy, he had really severe eczema. You know, he had to, like I said, he wasn't able to continue his studies. He had multiple emergency room visits. And so when we look at the functional medicine workup, again, we're going to look at digestive health and treating that, and maybe there's a yeast imbalance there. But one of the biggest things was it started when he went to college, and his symptoms, you know, came out probably triggered by mold that, you know, that was in the building. So now he's actually doing much better. He's doing great.
Back at the same school?
Well, he's going back, but, you know, he's not going to. We had to say he's not allowed to take classes in the basement, you know, in those buildings, because that's sort of what triggered his illness. But, you know, helping his immune system build back up using probiotics and looking at diet and taking, you know, him out of that environment, he's doing much better.
Were you the first physician he saw when he was?
Oh no, he had seen maybe 3 different dermatologists, you know, but still wasn't getting better. So this is where the functional medicine piece works really well, because, you know, he had gotten creams to use and antihistamines to use and steroids, you know, and it's to treat symptomatically, but it wasn't helping. It was still there, and he was miserable, you know. So addressing all of the components of his, you know, nutrition and environment and food and everything like that, he's doing great. He's on his way.
I'm just thinking about how hard it might be for people to recognize that they're sick from mold.
Yeah. Yep.
Because you mentioned it doesn't go, it's not like a high performance car where you're like 0 to 60 and you go, wow, yesterday I felt great, today I feel terrible.
Right.
So how do people slow down enough to recognize that they're sick? Is it really that they're not functioning, or is there a way to intervene before that?
I think the key is to, you know, for someone who's not feeling their optimal, you keep looking.
Okay.
You know, so maybe, and the thing is, our systems are so complex, so you have to chisel away at it, and, you know, maybe it's just diet, maybe there's something there, or maybe, you know, there's a nutrient deficiency, or, you know, maybe it's a genetic component. I mean, there are so many things to look at, but if someone's not getting better, we're missing something.
Did people say to him, "Oh, you're just depressed, it's first year
Actually,
freshman"?
yes. You know, and I mean, I'm laughing, but, you know, just because I see that so much, it's unfortunate, you know, that I think sometimes when we don't know what's going on, we think, well, maybe the person's depressed because we can't figure it out. And, you know, I can understand that, you know, I can't figure this out and it's frustrating. But, you know, then it's time to take a step back and look at it a different way. Okay. And that's why the history is so important, you know, and thinking about, when do I feel, you know, when do I feel bad? When did I start feeling bad?
So when he came home for weekends, did his eczema go away?
I think it was so severe that probably not. Okay. But I think removing him from that environment allowed him to get better. Yeah.
That's pretty amazing.
Yeah. But I have had people who have more of a reaction to, like a toxic reaction, where, you know, they enter an environment and a certain pain, you know, let's say one person who had abdominal pain, you know, and that was the symptom. And it was sort of bizarre because we did imaging and labs and looked at, is it a liver issue or a gallbladder issue? You know, all of that was looked at. And then when we sat down and started talking about it, and you know, this person said, well, you know, when I go into work, it's so much worse, and it happens, and then I get out and I feel better. So.
And they like their job.
And they like their job, and so she actually works from home now and does really well. But, you know, it took actually leaving that environment. Luckily, her job was flexible and let her work from home, where she's now able to, you know, deal with it and do better. But
so the symptoms aren't necessarily clear cut. It sounds like you're saying they're kind of, they can be different, interesting.
That's right.
Red herring type of symptoms.
That's right. Right. So it's something to keep on the radar, I guess.
And was it really temporal, meaning she would go to work, she'd get a stomach ache, and then she'd get, by the time she was home, her stomach ache was gone?
Really interesting.
So are companies open to these discussions, or are they?
Hopefully, you know, I think it's hard for people because, you know, you want to keep your job, and if you find out that that's the problem, and it's even hard for people if it's your own home. You know, let's say you own a home, it's expensive. You know, I just bought our first home and are learning. There's a lot of money that goes into it. So I think it's really challenging. You know, when you look at environmental exposures, now what? You know, what do I do about that? I mean, it's hard to leave a job. You know, maybe if you don't like your job, it's easier, but you know, that's a big deal.
Are there things to do? So say you're in your home. And I know I don't like to go to our basement because it's musty. So are there things to do that can ameliorate or remediate or make it better?
Yep. So you can, you know, air filtration is a good one. So let's say you even have a child with eczema, and let's say we did some testing and some allergies and found that they were sensitive to mold. So, you know, you might want to look in the bedroom and say, okay, let's put in an air filter, and that helps to,
like a HEPA filter?
Like a HEPA filter to help filter the air.
So you could just buy a standing HEPA filter.
You could, so that would be one thing to help. You know, and it kind of depends on the person and how severely they are affected, you know, by it. You might want to look at diet and see what you can do along the lines of, you know, eliminating mold in food. You might want to, you know, if you're looking at even like stuffed animals. So let's say, you know, I don't know, you're sleeping and you're drooling on your stuffed animal, and you know, so things like that potentially could be sources, or pillows, or you know, maybe running those through the dryer to make sure that there's not moisture there. So
I heard you're not supposed to wash your pillows.
Yeah, well, probably
because of the mold.
Yeah, or if let's say you're using a humidifier, you know, your child is stuffy because of mold. You know, you're running a humidifier and maybe not cleaning it as diligently because it's hard and it's a pain.
What do you clean it with though? Because you're not going to want to use bleach.
Vinegar. Yeah.
Vinegar.
Yeah. Vinegar.
Okay. Do you know the percent by any chance?
I'd have to Google it.
Okay. So some kind of vinegar.
There is a vinegar solution that you use to clean it out, and you just have to be really on top of that because it can grow, because especially if it's a warm mist, even if it's cool mist, it can grow mold. So then you're sort of blowing probably at least once a week.
Okay.
You know, rinsing it out every day, but then at least once a week.
Okay.
Using vinegar.
And okay, so you can put a filter, a HEPA filter in your bedroom. Filter. Do carpets harbor mold?
You know, dust can harbor the mold toxins. So, you know, in general, like for healthy home, we're thinking about, you know, how do we minimize toxins in the home? You know, in general, let's say even outside of mold, wall-to-wall carpets, You probably, hardwood floors are best. You want to think about chemicals that you're using, and this is just sort of in general, trying to use more natural ingredients for cleaning.
So you're talking about someone's toxic burden, essentially.
Exactly.
How many toxins are they exposed to?
That's right.
And what effect are they having?
Right.
I remember cleaning the bathroom when I was like 26 and having the worst reaction, and afterwards I
Yeah.
thought, oh, it was straight bleach.
Yes.
Really nasty.
Yeah. Yep.
No mold in my bathroom.
Thanks to the bleach.
Right. So the overall toxic burden then,
Right.
and that's probably where the foods that are moldy will play into
Right.
removing those.
Right. So in general, we want to, help our immune system and our detoxification systems function optimally. So the less we can stress them, the better.
So you mentioned some nuts, which I think are the staple of a lot of kids' diets. So
Nuts are-
peanuts and
yeah.
pistachios are the
Yep.
two highest in mold.
Yep. Those are some that are elevated.
Okay, and I know cantaloupe and coffee. Really?
know.
How about rice? Is rice a moldy food?
I know rice can have arsenic, but I don't know that rice is a moldy food.
Okay. Any other big
Yeah, and
ones?
it's kind of like there's nothing left to eat anymore.
Air and water. So decreasing someone's toxic burden,
Yep.
minimizing the allergens in a home.
Yes.
I would imagine you probably don't recommend that pets sleep in a bed.
Right.
And do
Right.
people still come to you as a patient when you tell them that?
Yes, you don't have to get rid of your pet, but if you're, allergic to the pet, again, it's going to be a strain on your immune system. So when we think about, immune function and health, and now it's wintertime, so we want to, help our immune systems work the best. So I explain it to people that your immune system is sort of one entity and it has its, maximum tolerance, I guess. So when things add up, if there are dust mites in the mattress, or there are, there's mold in the basement, or, all of those things can add up to then stress your immune system. So for people who have, eczema, allergies, asthma, and we're trying to really minimize those things, then, taking those little steps can really help.
So you're saying essentially that everything that we're doing layers on an additional layer of challenge.
Right.
And then makes it hard for the immune system to function. So even if it's removing a small thing,
Yep.
it can make a big difference.
It can. Yep.
Okay. What about dehumidifiers in
That
the
can
basement?
be helpful. Yep. So that can be helpful. And again, it kind of depends on if it's an allergy issue versus a toxin issue.
Yeah.
If someone has allergy, you want to decrease moisture, make sure your basement isn't damp,
Yeah.
and deal with ways to prevent that from happening. But if someone really has a toxin issue, then really just the presence of the mold in the house is going to be detrimental.
If people, I've always wondered this, so I'm not sure if you know the answer to it, but if people have mold in one place in the house,
Yep.
but have some kind of heating system that circulates air,
Right.
the mold, yeah, okay, so the answer
So
is
it can
yes.
blow it. Yeah.
You read my mind.
Well, let's say someone has forced hot air, and let's say, that mold can settle into dust, and actually that's one way to test the home is to test the dust for the presence of mold. So then you have, you turn on the heat, and that dust blows throughout the house, and you're kind of recirculating those.
Okay,
Toxins.
so that was really depressing.
I know.
But what you're saying is, yes, it's important to, so even if I don't go in my basement, it's important to treat the basement
Right.
so that it's not circulating through the house.
Right.
Okay, because I don't know. So let me think about this. Homes that have radiant heat are probably less allergenic than homes that have forced air.
Right, because there's less of that, dust kind of being pumped throughout the house.
But a whole house HEPA filter will help mitigate that.
Yep, you could do that.
Okay.
Yep.
So-
Vacuums that have HEPA filtration, washing things more regularly. It's a lot more work when you start to think about it, but
Yeah.
all of those little things can make a difference.
And then encasing so not having a down comforter.
Yeah, encasing the mattress, encasing your pillows can help.
And my vote as a parent is never to have stuffed animals ever anywhere in the house. I believe that when you wake up,
Keeping
there's
them
more.
on the shelf, that's right.
Okay. And anything else people can do? I mean, we've talked about a lot.
Right.
Does exercising outside or being outside, does that have does that help, harm, or is it neutral?
I mean, exercise is good for you, so any way that you can do it is great.
Yeah.
Again, if someone has environmental allergies, let's say they have spring allergies and the pollen's out. So if you're someone who likes to be outdoors, which is great, you just have to, as soon as you get in, take off those clothes, wash them, take a shower, because if you think about all this pollen, antigens, all those particles that are now in your respiratory system because you've been inhaling them being outside, if you can wash them off your skin, maybe do a sinus rinse, you're going to try to get them out of your body when you come back indoors.
Okay.
Keeping windows closed can be helpful in the springtime for people, with the spring allergies.
And it sounds like treating one component of allergies will help with the mold reactions.
Yeah, it's interesting because with allergy, even by taking steps, again, because it's a whole immune system issue, even by maybe treating a dust allergy, maybe you'll have fewer spring allergies. Mm-hmm. Or let's say, we see that with diet too. If you remove food allergies, then maybe your environmental allergies will be better. So even doing a little bit, it doesn't have to, it can get very overwhelming with all of the chemicals and molds and food, and it's a lot it's like a full-time job sometimes to try to think about these things and deal with them. So just remember, baby steps and thinking about, okay, what are my exposures? What can I do to help remove the overall burden?
And are there medicines that people can take or that you would prescribe that help?
Yep. So for people who have allergy, we think about things to stabilize the immune system. So we think about quercetin, which is it's a natural treatment. It helps mast cells, or the cells that release histamine in the body. So it helps to stabilize those so they don't release the histamine. That can be a great alternative if people don't like antihistamines. They feel drowsy with that. Mm-hmm. Even simple boosters like vitamin C. In the wintertime, things like elderberry. All of those to support probiotics are a big one, that helps the normal immune system happen. If someone has a mold toxicity, interestingly, so let's say we get them out of the environment and now we want to get rid of that, that issue. Basically, it's that the toxins are in the body and the immune system hasn't recognized that they're a problem. This is where the genetic testing comes in, where your body just doesn't know this is something that I need to deal with and get rid of. So they're there. So even if someone's had an exposure years ago, they might still feel ill. The medicines we use for that are, one is called cholestyramine, and it's actually was developed as a cholesterol medication, but it basically binds those toxins in the body and helps to eliminate them.
Okay. This sounds like if people are at that point, they need to see you.
Yeah, it's good to have someone to help investigate and try to pin down all the details because it gets complicated.
Do people come to you and say, I think I have a mold problem?
Sometimes. Usually it's more someone has symptoms and then we start talking about it. But there are people who are, aware of environmental exposures, or they feel worse in certain environments.
And is there anything I missed asking you?
I think the biggest thing is, not settling for not feeling well. And that's what really we look at in functional medicine is, there's always the next step. There's always something else to look at. And, environment and environmental exposures are one of those things that, not to forget about.
Thank you.
Yeah, you're welcome.
Thanks for joining us for another episode of Visions for Health. My guest today is Dr. Sarah Byrne, who practices at Visions Healthcare in Dedham, Massachusetts.